Dose response relationship. The dose response relationship or the exposure response relationship. This helps to describe the magnitude of the response of an organism or as a function of exposure to the stimulus after the certain exposure time. So here the dose response relationship can be described by the dose response curve. This is further explained in the following sections like, as I said before, the dose response relationship can also be called an exposure response relationship. This study comes under the branch of a pharmacology, specifically pharmacodynamics and the pharmacokinetics. The pharmacodynamics is the study of effect and the mechanism of a drug. The pharmacokinetics can be described as a study of drug action when administered into the body. Pharmacokinetics mainly deals with absorption, bioavailability, distribution, metabolism, and the excretion of the drug from the body. In this topic, we will mainly focus on understanding the drugs and their mode of action, which encompasses the dose-response relationship and the interpretation of the drug-dose relationship curve. Here we can know what is dose. The dose can be defined as the amount of drug administered into the body at the single time. For example, if a 200 mg of a paracetamol as a common drug is administered in a patient, so we can say the dose is 200 mg. Here we speak about the quantity how much we given to a patient. While speaking about the response, as I said before, the response can be defined as the expected action of a drug. If we given a drug to a patient, we can see what are all the changes we can get after the drug is induced. So, for example, as I mentioned before, if a paracetamol is administered, this paracetamol is an antipyretic drug, so which is used for reducing the body temperature. So the expected response for the fever here is lowering the body temperature. We can speak about the mode of action of a drug. To understand the dose-response relationship, it is important to understand the mechanism by which the drug functions. Any drug, when administered into the body, moves along with the bloodstream when it reaches the target site. It binds specifically to the receptor present on the cells of the target sites. The drug and the receptor binding initiates the signaling cascade that ultimately generates the appropriate response. It can be represented as drug plus receptor, drug-receptor complex response. Activation of the signaling cascade is not only the method by which the response is generated. The other method is a chemical interaction. It can be defined as a method where the drugs interact with the another biologically active molecule that can generate the response or act as a secondary messenger for signaling the pathway that in turn generate a response, regardless of the mode of binding of the drug or the route of administration. It is the concentration of the drug at the target site that determines the response of the drug. Here we can speak about the dose response curve. The dose response relationship can be described as a systematic description of the magnitude of the effect of a drug as a function of dose. In simpler words, we can say it is the relationship used for analyzing what kind of response will be generated at the administration of the specific dose of a drug. Here we can say about the cumulative dose response curve definition, which can be stated as the relationship of dose in response to the drug concentration. We can speak about the what is needed for the dose response curve. Why it is needed? It is needed for two main reasons. They are as follows. It is used to decide the dose of drug. It is used for the comparative study of the drug. That is the study of comparing the dosage to the percentage of a patient showing the different effects. It is used to determine the drug efficacy, which is defined as the ability of a drug to elicit a response when bound to its receptor. It is used to determine the drug potency, which is defined as the amount of drug concentration needed to induce a response. It is also used to determine the drug safety. The effect of drug is a function of both dose and the time, but the curve plotted is time dependent or time independent. The dose response curve is plotted at the maxima at the time of peak effect or under the steady state condition. For example, during the continuous IV infusion. We can speak about the concentration of the dose response curve. The dose response curve is a rectangular hyperbola where the intensity of a response increases with the increase in the drug concentration. It can be used to plot the result of any kind of experiment. The x-axis of the graph is used to plot the concentration of the drug, and the y-axis is used for plotting the response. There are some examples of response such as change in the membrane potential, enzyme activity, secretion of the secondary messenger, contraction, and the relaxation of the muscle, metabolic degradation of the certain compounds, and the secretion of the certain hormone. The shape of the curve. Here we can speak about the sigmoidal shape of the dose response, which can be described as the application of the Hill equation. Here, the Hill equation is nothing but the logarithmic function of the dose, according to which the graph can be interpreted. The dose response curve. This is the rectangular hyperbola because the drug receptor association obeys the law of mass of action, equal to E max into ddd by kd plus ddd, where E is equal to observed dose response at the particular concentration, E max the maximum response, and kd the dissociation constant. It describes the strength of the interaction of the drug to the receptor. The shape of the standard dose response curve is defined by the four parameters as follows. One is the baseline, which responds to the drug at the bottom, and the second one is the maximum response to the drug at the peak. And third one is the slope, EC50. This is a concentration of a drug that induces a response halfway between the baseline and the maximum response. Here we can speak about the threshold and the interpretation of the threshold limit. The threshold is an important feature of the graph. The threshold dose definition of the pharmacology can be referred to as the concentration of the dose of the drug, below which the patient does not have any way harmful effect from the drug exposure. The slope of the curve determines the threshold of the drug. A sharp increase in the slope of the graph shows the increased risk of toxicity with the increased dose concentration. Similarly, a flat slope defines the low risk of toxicity of the drug even when the concentration is increased. Here we can speak about the deviation from the standard curve. This leads to the steeper or the shallower graph. The steepness of the graph is quantified by the slope factor, also known as a Hill slope. A dose response curve that has a standard slope has a Hill slope of 1.0 as the steepness of the graph, which increases the slope factor of the graph increases. The steepness of the curve is correlated with the potency of the drug. The steeper curves have the maximum potency even at the low drug concentration. We can speak about the factors which are affecting the drug response. There are the following factors affecting the drug response. One is age, another one is weight, environment. We can also say the factor like gender, shock, and the immune condition. The dose response curve is widely used in pharmacology. Apart from studying the potency and the risk associated with it, it is also used to study the following factors, as it is used to study the dose response relationship in the epidemiology. The dose response relationship epidemiology refers to the study of at the population level the response to the compromises of a death, loss of consciousness, and other adverse effects of the drug in the population. Thank you.